So UNITY-CLL was a large randomized study for patients with both previously untreated chronic lymphocytic leukemia, those patients with who had prior therapy. And in this trial, patients were randomized to receive either the combination of Umbralisib and Ublituximab. Umbralisib is a recently FDA-approved PI3 kinase inhibitor in the lymphoma setting, and Ublituximab is a novel CD20 antibody. This was compared to Obinutuzumab in Chlorambucil, and the results of this trial have been previously presented. However, in this analysis, we looked at patients who had comorbidities, and it looked that might have prevented them or discouraged them from receiving, that might have prevented them or that might have been a hindrance for them to receive BTK inhibitor-based treatments. And so in this study, we found that, well, first of all, the previous results showed that, of course, that the experimental arm of Umbralisib and Ublituximab was superior to Obinutuzumab and Chlorambucil. But in this analysis, we looked at those patients with comorbidities and found that those patients with comorbidities did just as well as those patients who did not, and thus opening up, I think, a therapy for patients who might have contraindications receiving BTK based therapy. And so I think the importance of this is it just opens up another treatment option for patients with CLL, an alternative approach for those patients who might be hesitant to treat with BTK inhibitor based therapy.